Welcome back. If you're new here, I'm Chris, and I'm a medical doctor and PhD candidate in epidemiology, and I'm also helping the healthcare professionals to relocate to another country. And we also have our own website, globaljob4u.info. I drop the website links in our descriptions box below, and you can check it out if you want to relocate to another country. And it has been a while I couldn't upload a YouTube video because I'm overwhelmed with my research and other tasks. So today in this video, I want to talk about why you are keeping failing medical interviews and how to fix them. Okay, let's get started. Have you ever walked out of the medical interview and thinking, I answer everything correctly, but didn't I get a job? And even I review my medical knowledge and I prepare every questions and answer. Sometimes I practice with my friends, but I keep getting rejected. So this is the real what the interview is. Interview is not asking about how much you know. It's asking how reliable you are and how safe you are and how you appear in the interview with structures. So before we break down the mistakes you made in the interview, you need to change your mindset. I need to impress them. No, it's not correct. I want to show them how safe I am. And the interviewer are asking about every answer in your interview. This doctor or this person is safe with my patients at 3 a.m. So if you are safe doctors, you will get hired very soon. So let's get dive into it. The first mistake is the generic answer. Most candidates fail here, and they say, I'm a hardworking, I'm a good team player, I'm a good communicator. So most candidates say the same things, so you didn't stand out among the crowd. And if you want to make a good approach, okay, let me show you how difference between the response 1 and response 2. For response 1, I'm a good team player or I'm a good communicator. Okay, let's see the difference between 1 and 2. For the response 2, I'm very good in communications and I can communicate very well and effectively and efficiently under pressure or under diverse culture. So I can get the patient trust and I can avoid the misunderstandings between the teams, so we can provide the patient safety and ensure the patients ensure the quality service. So you in the response 2, you see the real situations and you see the result or the impact because of your good communication. So how difference between response 1 and response 2? If you approach with the response 1 in every interview, you will get the same result, rejected. The second mistake is the no structures. You might know the answer, but you explain it randomly, so it's too dangerous in interview. And unstructured thinking means you are an unsafe doctor. So for experienced questions, you should answer with situation, actions, and result. Okay, for example, can you share your experience in handling with difficult patients? Or if there is a team conflict, how will you manage it? Or can you share your experience in working with multidisciplinary teams? So you need to bring the example package with situations, actions, and result approach. Otherwise, your answer reflects that you are unsafe doctors. The number 3 mistakes is you are ignoring NHS or workplace value. Many candidates focus on clinical answer only, but the interviewer asks something deeper, and they want patient safety, they want communications and teamwork in your answer. So for these questions, how will you respond in real interview? If you are overloaded with multiple tests, how will you approach it? Okay, let's see my response. I prioritize the patients with triage, or I prioritize the patients by calculating the news-do score, or I prioritize the patients according to the life-threatening situations, and I delegate less important tasks to the competent doctors, and I clearly documented and clearly communicate with the team, and I will escalate to the senior if I'm overwhelming. This comprehensive way, I always make sure the patient's safety. Okay, in this response, you can see I'm focused on patient safety, communications, and teamwork. So this is how you need to respond in your interview. The number 4 mistake is weak clinical scenario approach. This is where many candidates fail badly and they straight jump into the diagnosis. This is sepsis. This is acute myocardial infarct. This is too dangerous for you. You didn't show up. You are a safe doctor. If you are a safe doctor, you need to approach with assessment, investigations, treatment, and escalations. And you might probably think they are being tested on diagnosis. No, they are testing about your safe management. If you cannot fix this in your clinical scenario approach, you will get rejected. The last mistake is poor delivery. You might have a strong clinical knowledge, but you speak too fast and you didn't make a pause and look unsure. So you need to fix them and speak clearly and slowly and make a pause after important sentence and keep the sentence simple. This interview is not assessing how complexity of your sentence. They are assessing you are safe doctors or not. These are the real experience when I train some multiple doctors for their clinical interviews, and I hope this video will be useful for your upcoming interview, and see you in my next video.